Welcome back to Healthy Living. We were just talking with Joy McWilliams from the Women's Pavilion, and now we're here with Kira Smith. Kira is a nurse practitioner at our high-risk breast clinic, which is right next door to the Women's Pavilion. You literally walk through a door to go through there. So thank you so much for taking time today with us.
Of course. I'm happy to be here.
We're happy to have you. So, you know, May is Women's Health Month. We want to highlight the things that we have to offer for women at St. Tammany Health System. So let's talk about you a little bit. Tell us a little bit about yourself.
Sure. I'm Kira Smith. I'm a family nurse practitioner. I work at the high-risk breast clinic for St. Tammany Parish Hospital. I grew up in St. Tammany Parish. I've been nursing for about 25 years. Providing quality care to our community is definitely a passion of mine.
Good. So that's nice. You're in your own community. You probably see lots of people that you know and you can help. That's great.
Yes.
So what is your role at the high-risk breast clinic?
So the high-risk breast clinic, we offer women who are at increased risk for breast cancer the opportunity to be proactive and take control over their breast health. When you come in, we have a very in-depth visit. We review family history, personal history. We will discuss and evaluate genetic risks. We will also go over high-risk screening recommendations and talk about ways to reduce risk. So by the end of the appointment, you have an individualized plan and you understand what the next steps are moving forward.
Yeah, so we kind of covered why someone might come. How do they get there? How does someone get there?
Great question. So you can self-refer, and who would come to the high-risk breast clinic? These are patients who are at increased risk for breast cancer. It'd be patients that have a family history of breast or ovarian cancer,
right.
A family history of a genetic mutation like BRCA1, BRCA2 that can increase risk for breast cancer. If they've had an abnormal result on a breast biopsy, and also if they have increased breast density or an increased Thyrokusic score. Those two things can be found on your mammogram report.
I gotcha.
So a Thyrokusic score of 20% or higher puts you into that high-risk category.
Okay.
So if you recognize that you fit into any of this criteria, we would love to see you. You can self-refer, you can call, you can walk over. We're right next door to the Women's Pavilion.
Right.
You could also ask your gynecologist or your primary care to refer over to us. So it's pretty easy for us to, get you in, get an appointment, and meet with you.
So what would you say makes our facility so special? Because it really is. It's a lovely facility. It's very warm, welcoming, calming. So what would you say makes it that way?
I agree. I feel like I work with an excellent group. Everybody's very caring and compassionate. They go above and beyond for every patient that comes through the door. And I think that patients really appreciate that. And I think that's something special about St. Tammany that we offer.
And we talk about that we have a multidisciplinary team. So for the person who might not know, why does that even matter? What is so important about that team, and what do they do? How do they kind of shore up the care?
It's amazing, the group that we have. Multidisciplinary for me, we are located right next door to the Women's Pavilion. It allows us to communicate in real time. And for example, if the radiologist found something that was concerning, they could pick up the phone, call us. We're right next door. Patients could walk over. We could get that appointment, immediately planned.
And then you have that gift of consultation as you go through the process.
Exactly. And I think patients really appreciate that.
So we know that you take patients through many steps of the process, from identifying, if they are high risk, if there's a problem, what to do next. And then we also offer survivorship care. What is that? What does that mean? What is that?
Great question. So with better cancer care, patients are living longer. A patient is considered a survivor from the moment they're diagnosed, during their treatments and throughout the balance of their life. Survivor refers to, having that cancer diagnosis, and sometimes you have special needs going through those treatments. For example, you may have pain, fatigue, mental distress. Our breast cancer patients sometimes are at risk for lymphedema. So identifying these needs and getting them connected with the proper intervention to help them, get back on track and overall, the goal is healthier outcomes.
Yes, and that's part of that multidisciplinary approach, because you can connect them with the people who can help them through it.
Exactly. We can connect patients with services like yoga, Tai Chi. There's acupuncture, which is effective for pain. We can connect with physical therapy, dietitians. There's a lot that we can connect our patients with.
Yeah, so
as
it's
far
more
as
than
resources.
just testing and diagnostic.
Exactly.
It's the whole person's care.
Right.
So what else would you like to add just about the Women's Pavilion, the high-risk breast clinic, what you do, and how fulfilling it is for you? Anything like that?
Sure. I love it. I think we're a great group. If you feel like you're in that high-risk category, we definitely want to see you. We're located right next door to that Women's Pavilion, like Joy described earlier. Yeah, it's a red brick building. If you need landmarks, it's behind the IHOP and the movie tower. But it's a great atmosphere. It's an incredible group, and we would love to help take care of you.
Okay. Well, thank you so much for joining us today. We appreciate you coming in to talk with us about Women's Health Month and about what we offer at the Women's Pavilion and the High Risk Breast Clinic. So thank you so much. We are going to be right back. We're going to talk with Jamie Romage next. She's from our new Family Center. So please stay tuned.